So thank you so much, everyone, for joining us today. My apologies for the technical difficulties. We have a little over 80 attendees today, and this is being recorded and will be posted on our website. And so I will go to our agenda. First, just do some introductions. I'm Raquel Rose. I get to be the superintendent here in the Kentfield School District. Ted, you want to go next?
Hello, everyone. My name is Ted Rule. I'm a pediatric infectious disease doctor at UCSF and a parent in the school district.
Laurel.
Hi, I'm Laurel Eroon. I'm the school nurse for the district.
Hi, everyone. I'm Shilpa Marva. I'm an infectious disease physician, and I work at the Kaiser Permanente San Rafael Medical Center, and I have a child in Basich and a child in Kent, so I'm a parent too.
So tonight what we're going to talk about is what's going on locally related to our data around COVID and transmission rates. We're going to hit on the site-specific safety protection plans and the updates that we're implementing as a school district, talk about the purpose of the plan, and just really highlight the areas that are changing as we transition to this next phase of instructional programming. We'll touch on some frequently asked questions and then end with some opportunities for folks to ask some questions to the panelists. So thank you so much for joining us. And again, we will be recording this and posting it to our website following this event. So first, just reminding people where we're at. Marin is currently in tier 2, the red tier, and we're trending towards the orange tier. We have the full permissibility to be operating in-person instruction, and we've been doing that here in the Kentfield School District since mid-November. And so we're just going into that next phase of expanding in-person opportunities for our students that so choose. In terms of vaccination, we're quite fortunate. There's been prioritization for our local educators to get vaccinated. So by April 12th, those that choose to be vaccinated will be fully vaccinated. So that's a great additional safeguard for us to have available to our community. And the last point here is just related to the 30-point guide. And we're going to go through that today, highlighting the areas that we're adjusting so that we can expand into the way in which we're doing starting this Monday, March 22nd. But I do also want to note that our local public health continues to identify changes that may need to happen with our 30-point plan that they've guided us over the course of the last year and a half. And so on March 23rd, there will be an update from public health about additional changes that may come forward. So we will be in alignment with that and follow suit accordingly. And so Shilpa, this is you.
Thank you, Raquel. So this slide shows some Marin County COVID data. And we just passed the 1-year anniversary of the first Bay Area shelter-in-place order on March 16th. And our county exited our most recent regional stay-at-home order on January 25th. We've come a long way since then. We continue to see a decline in the number of COVID cases. And while we are currently in the red tier, like Raquel mentioned, we are expected to move to the orange tier as early as next week. All of this data on this slide is available on coronavirus.marinhhs.org. I will not get too granular with the data, but the two numbers that I would like to highlight are the adjusted cases per day per 100,000 residents, which for Marin County is currently at 3.5. And just a reminder, to be in the orange tier, that number has to be between 1 and 3.9. For those interested, the rolling state average is 5.9 at this point. Kentfield also saw, so if you go on the website, you can actually get granular level data. And we know that Kentfield reported 11 cases in the last 14 days. We expect the numbers to continue to decline as we continue to make strides with vaccination. And currently our county actually leads the state in rankings for COVID-19 vaccination rates by county. And with that, I'm going to hand it over to Ted.
So this slide shows a snapshot of the Marin County School dashboard. And if you haven't looked at it before, I'd encourage you to check the links and look at it today and follow it. It's been really kind of impressive to watch as things have evolved over the past months. And I think since the last time we were involved in a panel like this, it's kind of really exciting to come back and take a look at it here and kind of talk about what it shows. So if you look on the far right, I think a couple of key numbers to draw your attention to it. First, the number of in-person days is 119. And the average number of students in the past 5 days was 21,000. And that means that the number of kind of student days, like in a sense, a real kind of denominator of exposure time, one way to think about it. The other way is about success for kids that were actually in student days of success of kids in school was over almost 1.5 million. So a really stunning number. The number of students that were offered on-site was 100%. Cumulative numbers of positive in students is 203. And of course, we never expect that to be zero because children are going to acquire it in the community based on community rates. Same for staff was 52. And the other big kind of portion to focus on now is in-school transmission. So student-to-student cases of transmission occurred in 6 cases. So that would be 6 out of the 203 that were ever documented. Adult-to-adult is 3, adult-to-student is 2, and then not a single case of student-to-adult transmission. Now, we don't like cases at all. We don't like among adults or students or transmissions at all, but those are very low numbers for the number of cases that were gone in the community and the number of cases that came into school. A real testament to success. And for people that don't know, kind of Marin's success is often cited within California for how well things have gone. I'll pass it on to next.
Great. So this 30-point plan was devised by our local public health in collaboration with the Marin County Office of Education. And they came together to identify universal guidelines that could be implemented across all schools within our county, private, public, parochial, independent, in order for us to have a framework to work with as we contemplated the opportunity to open for in-person instruction. The key piece of this plan is that we have to acknowledge that this is an evolving situation with COVID, and we've seen that transpire during the course of this last year, and really have to think through the protocols that might have what we were used to were going to look very different. And so that's been a challenge at times, but as you know, we've continued to move as things have changed with us, we're beginning to become more comfortable with the mask wearing, with the distancing and such. But it's really important that we recognize that this is an evolving situation. And so as early as next Tuesday, the public health is going to be having another community meeting, and they're going to be announcing some updates and revisions to the 30-point plan. So obviously we start with students full in person on Monday, the 22nd. So we're going to follow the plan as it is now, but we'll again be hearing from public health how they're making changes and adjust accordingly. And I'll be sure that invitation is posted in the follow-up Parent Square communication that will go out, and then it will also be recorded, and so we'll be sure that gets shared with the community at large. So these first 5 guidelines that I'm just going to touch on briefly, we're not really changing any ways in which we address these. So guideline 1 is just, again, acknowledging the changing shifts that happen related to the 30-point plan. Guideline 2 is just being sure that we're continuing to maintain the practices and protocols that we believe will keep us as safe as possible. So utilizing the essential protective equipment, the mask covering, the hand hygiene, maintaining student and staff attendance tracking. So you'll hear in a little bit that we will be continuing with our screener that happens at the home or in offices, and just supporting the hand hygiene and hand washing, just really maintaining those protocols and those practices for our kiddos. Guideline 3, just the importance of training our stakeholders. So having these opportunities where we can go through this information with our community at large. Our site administrators will continue to be working with their staffs as things change and giving them updates. And obviously this recording will be posted to our website. And guideline 5 is the intensified cleaning. So Paul Miller, our Director of Maintenance and Operations, has worked closely with his team to be sure that they have the essential equipment necessary to be sure that spaces are getting cleaned and disinfected on a regular basis. And so just being sure that we're maintaining that necessary cleanliness. We do have public health liaisons for both sites. So Laurel, who's on the call today, you'll hear from her in just a bit, but Judy Sellers and Grant at Kent Middle School and Lynn Bartha and Marianne over at Basage are the key people for you to contact related to the happenings at the school sites. Every Thursday, there are public health liaison calls that are happening, so updates happen in real time. We also have a schools team that we can access and ask questions, and they're quite responsive. So when things come up or wonderings we have, especially as things shift, we have resources and people that we can turn to get some clarification straight to public health. Guideline 6 is, as I mentioned a bit ago, this is the screener, and really being sure that we're continuing with the daily health screening. And we just believe that it's a way for us to stay very vigilant about kind of how we're feeling, and that if it's appropriate for us to be reporting to work or reporting to school. And so that will be maintaining. That being said, right now, when students arrive at school, they do have their temperatures checked, but we will not be continuing that. That has been something that has been not necessarily required for quite some time, but it has been something that we've just maintained as a district. But as we move into this next phase, we will not continue with the temperature checking, but we will continue to have families complete the daily screener. And if your child does not come to school, we still expect that you would complete that screener, so we're aware that he or she or they may have some symptom, or there's some follow-up that can happen from our office. So it's just important to continue to respond to those screeners on a daily basis so that we have a sense of what's going on. Guideline 7 is related to when to stay home, and that if you are feeling sick or you're not up to par, we really want people to stay home out of excess of caution. And so I'm actually going to hand it over to Laurel, who's going to speak more to what happens when there's exposure and staying home. So Laurel. Oh, you're muted.
If you have an exposure in your household, then the people who are exposed will need to quarantine, and there's specific guidelines for that. It used to be for 14 days. It's now 10 days quarantine unless you would like to take a test on day 5 from exposure. You can shorten your quarantine to after 7 days if you have a negative test. So testing, there is a lot of testing in the county now. In fact, there's lots of appointments available. Curative is at the Civic Center Monday through Saturday. So Tuesday, Wednesday, Thursday, Friday, Saturday. And then there's also a van that's available, a mobile van around the county that changes sites. So if you go to curative.com, you can find out where the testing sites are and sign up for an appointment. Their results come back within 24 to 26 hours. There's also a state supported site, LHI Lab, which is in San Rafael on East Francisco Boulevard. That's available from 7 a.m. to 7 p.m. Tuesday through Saturday. There are also testing sites available at different providers, Kaiser, Marin Health, Marin Canal Alliance, there's Walgreens, CVS, Dignity Health, Urgent Care. So lots of testing sites available if you find that you're exposed. If you are exposed, it's very important that you quarantine while you're waiting for results as well. I think a lot of people don't understand that. Do I need to cover anything else on that? And also the district is offering testing monthly for staff members and community members. We have testing tomorrow at Basich. There are slots available. It's not full. Probably can't sign up now, but if you come by Basich, we'll get you in if you want to be tested. So if we have a case or an exposure at school, the county has given us different scenario letters that we send out. If we have a positive case in a classroom, we send out a scenario letter 3. And in the past, we've closed the whole cohort. So now it's recommended to close K through 2, and 3 through 8, we will be doing contact investigation on those classes. So students are going to be 4 feet apart, and Dr. Well will address that shortly. So anyone within 6 feet of a positive case will have to quarantine, and then I will be doing case just investigation to find out who else might have been in close contact with the positive student or staff member in the classroom. So we're no longer closing classrooms due to positive cases in grades 3 through 8 because we've not had any, I know in Kentfield, any of the cases that have been positive, we've had no other student or staff member test positive as a result. So that's the reason for the contact tracing versus closing cohorts, except for the lower grades, K through 2. If a student is exposed to a positive household member or another person who is positive, that particular student would need to quarantine, and we'll send out a letter regarding that. And then follow-up letter does go out to let parents know if there's been any positive cases as a result of that exposure. So the county will be working on a scenario 3A letter to reflect the contact tracing aspect of grades 3 through 8, so that parents are aware there was a case in the classroom, but that their student may return to school and not have to quarantine if they weren't within close contact. And then hopefully everyone has seen the decision tree. This one was updated February 23 to reflect the change to tier red from purple. And a new decision tree will likely come out when we move into the orange tier. But it really goes through all the different scenarios based on symptoms, exposure, high risk activity. And if you look through it, it might look a little confusing, but if you really follow the bubbles and the arrows, it's pretty explanatory. And I hope everybody takes a look at this, because we follow it very closely in public health and in the schools. And the schools work very closely with the public health department, as Raquel alluded to. We do have a school team that's very responsive. The school nurses have been meeting once a week with the health department. We've been attending the liaison meetings every Thursday. So we are in close contact. We're getting updates in real time, daily and weekly. So if anyone has questions, we really do follow the decision tree.
Yeah, and I'll just chime in here. One of the big questions we've received is related to the educational programming that students will receive when or if they need to be quarantined. And so we really want people to quarantine if they've engaged in any high risk gathering or out of state travel. It's really important in order to maintain the safety of our community. And students will be provided educational access during that period of time. Both the sites have devised a plan that in tonight's message through Parent Square, I will have information about that in particular for people to know. We also have created a form that families can complete to notify us about initiating the need to access educational programming if quarantined. Especially recognizing that spring break is coming up the week of April 5th, and there may very well be families traveling or engaging in some behavior that might lead to the need to quarantine. And we're highly requesting people to do that. You'll get access to your programs. We'll be sure the kids get the education that they need and deserve, but it's really important that we maintain the safety of our community and that people are quarantining on their return so that we can be sure that we can keep schools open.
I also want to add to the contact tracing. So anyone in Marin County who tests positive for COVID-19 is contacted by a contact investigator from the health department. Then we work very closely with the health department as well and the schools team. And if there is a positive case in the school, there's a whole system within the CalConnect that is called the SPOT system, and we do create a contact tracing specific to that event in a school. So it's very closely looked at. So I think that's also keeping our children safe and our staff safe as well.
Great. Okay.
So the next guideline, guideline number 10, is about spacing, and I'll just read it quickly. Where practicable, physical distancing of 6 feet is maintained between adults and students. 4 feet distance is permissible between students within a classroom or instructional area where requirements herein are in practice. And I think this is a topic that, particularly in the last few weeks, has gotten a lot of attention. And I wanted to just set out a few principles that I think are important as you kind of think through this information, and I look forward to discussing it more at the end. So I want to step back to kind of the beginning of this pandemic when we were trying to come up with guidance around prevention of infection. And one of the key concepts was this idea that, well, we have this droplet spread, and the further you are away from the person with the droplets, the decline in the incidence as the droplets fall from the air. So it's not like a cliff at 6 feet. It's a decline that starts at the person and goes down further you get out. And they had to wrestle with this to decide, well, where do you draw that line? And it felt like, well, most of it is somewhere in that 3 to 6 foot range. The CDC took a line of 6, thinking it's conservative, it's good, simple messaging, we're just going to make it 6, and then you saw 6 everywhere. But the World Health Organization decided a meter, which is 3.3 feet, drawing the line a little closer, making a little more like, oh, it's practical, but still you have decline. So the origin of this was thoughtful, but also not because it represented some actual natural thing at 6 feet so much as it was the decline. Now, onto that, we have 2 other key components to prevent transmission. It's not just the distance, it's masking, of course, and it's ventilation. And together, the combination of those is really what kind of prevents it. Now, So what's different now between when all these guidelines were originally set up? I mean, it was a kind of, I mean, I guess you can call it an experiment. It was like our initial experience. We set these guidelines and then we lived life with these guidelines. And it turns out they worked. In adult transmission with ventilation and masking and 6 feet worked. And then many schools, including our own, went on board following that guidance. And what's different now is we have a lot of information from how schools and how other places have done with this spacing. We know, you just saw from the school dashboard, how well we've done in Marin. And there have been a couple major publications in both from the CDC and from other literature around cases in Georgia and Wisconsin, and most recently in Massachusetts, that show that, well, less than 3 feet, more transmissions have occurred. Places with 3 versus 6, really, it's very low and similarly low between 6 and 3 feet. So a lot of increasing confidence, and I can talk more about that later, that really 3 is probably good enough with the way things have gone over the last stretch. So again, not 3 feet in isolation, but 3 feet with good practices around ventilation and so on. And of course, you can space more when you can, but when needed to give access to schools, which we know is of critical importance these days for mental health and other reasons of equity, it's 3 feet is fixed. So what we're anticipating both from the CDC and from our local health department, state as well as local, is permission to kind of go to 3 feet spacing when necessary to in the context of schools. And that's something that a lot of our community infectious disease has thought about and are supportive of. And you can look forward to that, I think, probably coming out in the next week. So I think I'll leave that there. If I talk that much on every slide, we'll never get done, but I look forward to questions about this afterwards. If we go to the next slide then. And so the next two guidelines, we won't go through them in quite as granular, but the idea is another key concept in mitigating transmissions that do occur is keeping stable group sizes. And just so we track who is where and if there is any sort of exposures, that we know who it is. So this is going to be the class sizes are of course going to increase from what they used to be, but they're going to be stable, and we're going to have kids are going to sit in the same place, I think, and it's going to be we're able to track kind of where they go. There'll be some movement of instructors, but they'll try to keep, as you would expect, and as is rational, kind of spread and contact to the minimum necessary to get the job done. So I think I'll leave that there for this one. And then finally, around kind of arrangement of desks. Again, so ideally they'd all be kind of facing forward, but it's also possible, I think, to have when necessary, not always just facing forward, but some students facing to each other. But ideally facing forward to have all the kind of direction of potential shedding to go forward. I think that's the last of this stretch, and then we'll pass it back to you.
Yep. So these next guidelines talk about the procedures related to entry and exit, arrival and dismissal, the movement of the children on campuses, and then related to large gatherings. So, just kudos to our site teams, our administrators, and the staff working together to really determine what are those entry and exit areas that the kids are going to be coming in and out of. And then the staggered arrivals, dismissals, the recess, and lunch breaks that are going to happen for all of our students, and being sure that they are staying in their stable groups during those periods of time. And it will, obviously be a challenge, and the need for really all hands on deck while that's taking place. The congregate movement, just having that minimized, and so really being sure that kids are following the arrows. I was at Base Edge earlier this week and just watching the teachers say, okay, get on your arrow, and clearly just continuing to reinforce the need for the kids to be following the requirements that we have related to movement and not bunching up. And then the last one related to large gatherings. So currently those are still prohibited, but as you might be hearing, we are projected to continue to trend in the right direction related to case rate in our county. And so I was on a call this morning with Dr. Santora, just talking about the possibility of, in the late spring, being further along in the yellow tier, where there might be more permissibility to allow for gatherings for things such as promotion or graduation in outdoor settings. So I know they're really talking about those opportunities coming back to fruition for our students. And so I'm trying to pay close attention to how that might transpire in the next couple of weeks. Guidelines 19 through 22, these one around the air purifiers and the ventilation in the classroom. So we have air purifiers in each classroom. Our staff are continuing to keep doors and windows open just to increase that ventilation when it's been quite cold. sure today was a challenging day with all of the rain. And so, but I did hear the forecast next week is to be a bit brighter, so that'll be good. But we are continuing to keep those purifiers going throughout the day so that we have the best air quality possible for us in our spaces. Shared playground equipment, and so really trying to limit that. And if anything is shared, that it's clean between uses. Non-classroom spaces, using the gym and multi-use rooms. So just being sure that we're maintaining that physical distancing. And in terms of food, outside of trying to do that outside of the classroom as much as possible, and just trying to be sure that things are individually plated or bagged for any kind of service. So we will be offering lunch, a nutritious snack at Vasage, but lunch here at Kent. And I know the team has worked hard on trying to be sure, or not trying, but being sure that they have the best safety mitigation strategies in play for our students. These next three talk again about the routines and schedules that are developed for in the classroom, the kids washing their hands. We do have hand sanitizers at each entry point of classrooms. We also are having individual hand sanitizers at desks in certain spaces that have been identified. And also maintaining the face coverings that all students are required to continue to wear their face coverings. One piece that I'm hearing that there may be more specifics about is just retraining our kiddos on how to put the face coverings on so that and the proper fit of the face coverings. And then again, just trying to be sure that we're following all of these protocols and procedures as they continue to be necessary for us as we operate. And then this next section talks a lot about sharing. The first two, 26 and 27, the importance of trying to minimize sharing as much as possible. So we really are trying to have individualized spaces for kids and they have their own little buckets where they have things that they're going to be utilizing so that students are not sharing materials. And then the last one here is around privacy boards or the clear barriers. So we are setting up classrooms that would have access to those clear barriers, especially in areas where there may be more opportunity where kids are going to need to face each other just based on the way the desks are set up. So just continuing to follow these guidelines that are outlined by our public health. This next one is related to volunteers. And so we've been working as an administrative team to determine, is now the time that we're able to think about a way that we can have volunteers back on campus, especially with having more students and maybe need some more forms of supervision. And so it is permissible as long as the volunteer is identified as somebody that would be an essential worker and that they would be clearly adhering to all of the public health safety guidance that we are outlining. They are not required to have vaccination, but it is highly recommended and they should. And so we're still working through the need and to determine if that's something that we're going to have to put into play. I think after these first 2 weeks before the spring break will give us a lot more opportunity to see what it's like with the higher numbers of students on campus and to think through if we're able to bring volunteers onto campus. So more to come on that for certain. And then this last guideline just speaks to posting of the site-specific safety plan. So in tonight's message, I'll push out, it will be attached to that. I believe it was attached to the reminder message that came yesterday, but I want to highlight the community meeting that's going to happen on March 23rd from 11 to 12. It will be recorded and will be offered in Spanish as well for simultaneous translation. But at that meeting, we're going to hear about the updates and the revisions to this 30-point guide. So as we hear that information, we'll make the appropriate adjustments to our site-specific safety plans and release that out to the community as well. But just know that's coming. So here are some frequently asked questions that have come up. And so just the group here will just answer these as we know them. And so I'll just kind of go down this list and then we'll open it up for questions from the crowd. So if you want to go ahead and raise your hand so you can line up and we'll call on you. So the first one, will the week following spring break be a distance only week? So in the past, that is something that the district has made the determination that we would move to remote instruction following any kind of extended break. And the circumstances were pretty similar each time. And there was at this point in time, though, with our transition, we are not planning to have that be a distance only week. We will resume full in-person instruction on Monday, April 12th. But as I mentioned earlier, the importance of quarantining if you have participated in any high-risk activity high-risk gathering or travel. It's really important in order to maintain the safety of our community and to keep our schools open. Ultimately, is we need people to do the necessary medical quarantining when they return from any vacation they may go on during that spring recess. So as I mentioned, there will be a form that's going to be sent out that people can sign up and let us know so that we can do everything we need to be sure that your child is fully prepared for the distance learning that they would get while they're quarantining. So just for people to know that. The next one is related to the COVID testing, and Laurel touched on this, and I don't know, Laurel, if you want to chime in here, but we are getting questions about COVID testing being offered weekly. And Laurel, you want to just chime in on summarizing what you had shared earlier about the testing slide?
So right now the district's offering testing once a month. There is so much testing available in the county for people to access. It's free. So I encourage anyone who wants to get tested to get tested. You can go to curative.com. You can go to your healthcare provider. A lot of the, like I said, the drugstores and One Medical, there's lots of places that are testing. So I just recommend that if you do not have symptoms and you're testing because you're in quarantine, to please make sure that you are getting a PCR or a molecular rapid test and not an antigen rapid test. The rapid antigen tests are not very, they're not very good if you don't have symptoms. So please make sure you're getting a molecular rapid test or a PCR test on day 5 from your return from travel or from your date of exposure, and not too soon. Because if you test too early, you might not have the viral load to get a positive test and you'll get a false negative. So those are the recommendations for testing at this point. Some districts are offering weekly testing. At this point, we're going to stick with the monthly testing because of the availability of testing in Marin. If anybody has questions about that, I'm happy to tell you sites to go to. You can email me. You can also go to coronavirus.marinhhs.org, and the testing site will come up. You can click onto the testing that's available in Marin.
Thank you. Are all staff vaccinated? And so, no, not all staff are vaccinated, but all staff have had the opportunity. It is a choice to be vaccinated. I will say a significant percentage of our staff have gone ahead and accessed the vaccination. And as opportunities continue to present themselves, we continue to offer folks that have not yet got vaccinated to be vaccinated. So if they are not, but we will continue to be offering all these safety mitigation strategies. Why can physical distancing be 4 feet now, but not earlier? So Ted, you want to take that?
Sure. You know, I think I kind of tried to in my comments, so maybe I'll hold off and then because I don't want to run out of time for people to ask other questions.
Sure. And then I touched on the parent volunteers, so more to come on that one. And then the next one related to physical distancing requirements for fully vaccinated people. So I would look to one of our doctors to answer that one.
I'm happy to take that one on. So actually the CDC just recently published recommendations for fully vaccinated people on March 8th. And people are considered to be fully vaccinated 2 weeks after receiving the second dose of either the Pfizer or the Moderna vaccine, or 2 weeks after the single dose Johnson & Johnson vaccine. This guidance is available on the CDC website, and fully vaccinated people can actually meet with other fully vaccinated people without a mask or physical distancing. Now, as an infectious disease doctor, my advice to people generally is to start low and go slow. The guidance will continue to follow the science and will keep evolving. The more realistic situation is it tends to be, gatherings tend to be mixed groups where you may not always be certain of the vaccination status of individuals. So when in doubt, always, follow the whole distancing and masking requirements.
I'm going to stop share now, and there's people that have their hands up. So I'll just call on folks and we will go from there. So first up, Linda.
Hi, thank you so much, and thank you for holding this meeting. It's regarding, my question's regarding the teachers that have been vaccinated and who hasn't. According to my daughter and friends, there's quite a number of teachers that aren't going to be available when school starts and we're going to have to incur the cost of subs for many weeks. Is that true? And how many teachers at Kent are not going to be there because they want to wait till they get the second vaccine?
Yeah, so it is definitely not the majority of our staff. We will have some subs as we start, but it's not a significant number that is going to have a significantly negative impact on us financially. But we will have some subs. And so I know people have continued to kind of adjust their plan a bit, and we've been wanting to be as flexible as we can be with staff. And so the number, I don't have the concrete number here. I don't know if Grant and Marianne want to chime in about what they know. And then there's some that may be out for other reasons, not necessarily just due to the vaccination status. So just to also note that. So I don't know if that's helpful, but.
And are those subs vaccinated?
So our countywide sub list did allow all of our subs in the county to get access to vaccination. And so if they, just like our other educators, they had the opportunity to get vaccinated if they so chose.
Also, Raquel, some of the teachers wanted to wait until they had their second vaccine. Most of the staff have had their first, but some teachers wanted to wait until they were fully vaccinated with at least 2 doses to come back.
Yeah.
Okay. And so is that the ones that are waiting for their second vaccine? How many weeks are we going to be having subs when we start school?
So they will be all back by April 12th. We might have 1 or 2 special cases, but the plan is all those that have been fully vaccinated or have the access to be fully vaccinated, they will be back by April 12th.
Okay, wonderful. Thank you so much.
Yep, not a problem. Jamie.
Hi, thank you. I need more information on what constitutes a proper face covering. For example, we've been winging it with bandanas. I don't know if those are okay or not.
Laurel, you want to take that?
So we are not allowing bandanas or gaiters at school because they really have to be double ply, and we can't go around and check everybody's bandana and gaiter. So we are recommending cloth face masks that should be double ply, or the surgical mask. We don't recommend masks that have the ventilation port on it. Those aren't good for COVID. So if you go onto the CDC website and also into our parent handbook, it links you to the CDC site on proper face coverings. Does that help?
Yes, thank you.
The problem with the gaiters is that the kids have a really hard time keeping them up on their faces, especially when they're outdoors at PE and recess. I've seen some kids with them, and I'm like, let's get you a mask, because they're not allowed for that reason. They do fall down and they're too thin. And the key to a mask is that it fits you right and you're not messing with it all the time. If you're constantly touching your face because your mask is falling down, it's not a good mask for you.
Okay, Anna.
Hey, we have a question about random testing at the school. How frequently will it happen? We've heard once a month, but that seems too infrequent to give good telemetry and lower than what we've heard of in other states and UCSF recommendations.
Mm-hmm. So we've just continued with the once a month testing that we're offering on site, and that is for staff and for community members. Parents ultimately will make the decision if their child will be tested. And as Laurel mentioned, there's a lot of opportunities throughout our county. I don't know if anybody else wants to chime in terms of what other physicians might say related to testing and the requirement for that or need for it.
I'd say that the frequency of surveillance testing is not something around which there's great consensus about what's useful. I think it's really hard because to do it to the level of preventing infection would be basically every day for everybody. Shy of that, you're really just being kind of superficial. And I think, it depends on so many factors, on the incidence in that setting, the risk is going on in that setting and stuff like that. So I think honestly, a lot of the emphasis on how to operate open schools and even medical centers safely is not about the surveillance testing. Even at UCSF, where I work, the surveillance testing is voluntary in most cases. I mean, I think it's actually all voluntary, and there's not a lot of evidence to drive exactly what frequency is just right. I know, Shilpa, if you want to add, your thoughts or what they're doing in Kaiser.
So yeah, I'm just going to echo what you said. Testing is not prevention, right? We know that. And over-reliance on testing can lead people to sort of take the other infection prevention measures less seriously, which we know are more important, like the masking and the distancing. So I agree with you. And same at Kaiser too, it is voluntary. And really, as the number of vaccinated people in the community increases, we are going to see less of a demand for surveillance testing.
And
Yeah.
the test only tells you if you're positive or negative on the day that you test. So you might be negative on Tuesday, but doesn't mean you're not going to be positive on Thursday if you've had an exposure. So that's the other piece with that.
I mean, I work at UCSF too, and you're right, it's largely voluntary, although there's a lot of random testing available there. But, we're not sitting 4 feet, away from each other. We're quite distant, and so it's a different situation. And surely more testing will give us better telemetry.
Okay. Well, thank you for that feedback.
I have another question. So the spring break, so everybody's going to be back in person on the 12th.
Mhm.
And is it like, are you saying that the people who are traveling, I haven't read the guidelines as far as traveling, but is it up to the parents that are traveling to self-quarantine? Is that what I'm understanding? Since everybody's going to be back live in person, but those who have traveled, and are those guidelines, are they the Marin County guidelines or are they the Kenfield School guidelines? I just don't know where those guidelines are to be found.
Yeah, no, thank you for that question. So we, on one of the slides just a bit ago, we referenced the decision tree. So there is what we call the decision tree that is defined by our local public health. And on that decision tree, it outlines why you might quarantine or why you might make a decision about coming to school, obviously. And so that we are going to be following what that says. And on the decision tree right now for Tier 2 red, anyone who's engaged in high-risk gatherings or out-of-state travel should quarantine. So it's clearly stating that that's something that needs to happen, and it would be considered a medical quarantine based on public health guidance. And so our expectation as a school district is that we want families to be following that and to make that determination. So to be proactive, we have devised a plan where we're asking people to let us know up front if that's what they're planning to do, to travel during the period of time of spring break. And once they return, we would have their child participate in accessing their educational program through a distance. And so we're just asking people to be proactive because we know that as long as we're following this guidance coming from our public health, we're keeping our whole school community safe. So it's not a Kentfield School District determined plan. It's something that's coming from the public health. So Laurel, do you want to chime in on that?
I was just going to, maybe I'll just quickly jump in to say, it's, to answer your question, it's the state, it's the county, it's every level, and regardless of school, like in most people's workplaces, I would hope would be re-emphasizing the message. So it's not just guidance about schools, it really, people should just know it. It really should affect everybody in the state.
And the CDC has issued it, so it'd be the nation, but out-of-state travel is what requires quarantine.
Great, thank you.
Juan Carlos.
I think you might have you're on mute situation there.
There we go.
Can you hear me now?
Mm-hmm.
Oh, sorry about that. So my understanding is to have a test when you have the symptoms, but not just because you just want to have a test. It doesn't make any sense, right?
The best test is a test when you have symptoms. That's going to be the most accurate. If you feel like you've been exposed, that's also another reason to test. If you've engaged in high-risk activities, such as gatherings with lots of households or travel out of state, you should test. been exposed or you've engaged in high-risk activities, you should wait 5 days before you test. You don't want to test too early. But to just test periodically for whatever reason does not necessarily provide much information, although, community testing is one way to help mitigate the spread of the virus for sure. But that's not, you don't want people to have a false sense of security that they had a negative test so that they definitely don't have COVID.
I also have another comment. It is really nice and very aware of when they have a vacations time to wait for a week in order for the people not to be contact with others, because many problems can comes up, or many people that they say they never go out when they already did. It can cause more of the effects in others people's life. So it's very important to I noticed the time before that there was 1 week vacation, and after that week there was a week without a school, and it was perfect because we don't contaminate any other people or when related with someone else that has the possibilities of being with the COVID. So it's very important to keep with that procedure.
Exactly. Thank you. We hope people will be good community members.
Are you talking?
Okay, thank you.
Thank you. Okay, any more hands? Anybody else have any more questions? Well, I'm not seeing any more questions, and it is a little after 6, but we did start late. So I guess what I'd like to summarize with is, first, I want to just extend my absolute appreciation for our parents and our local physicians that are here on this call helping us with this presentation tonight. Laurel, thank you for your time too. I really appreciate it. And special thanks to all of our families out there and our staff that are joining in today to hear this update. It's really important that we're all on the same page related to how we're transitioning into this next phase. It's a big step for all of us, and ultimately we want to maintain as much safety as we can for our students and our staff and our community as a whole. So the key is that we recognize this is a community approach, and that if we're all aligning with what we know is the right public health guidance that's out there for us to follow, that we'll be in good stead. So I thank you for your time tonight. I will follow up with this recording as well as the PowerPoint and some resources, updates related to educational programming in quarantine, and different other resources that would be important for folks to see. So thank you for your time, and I hope you have a great rest of your evening. Take good care.